Chronic dehydration destroys your kidneys, and 90% of people do this wrong every single day. Your kidneys process 50 gallons of blood daily, but chronic dehydration forces them to work overtime, concentrating urine and struggling to filter thickened blood. This constant stress damages your nephrons and creates the perfect storm for kidney stones, high blood pressure, and eventual kidney failure. Here's what's shocking. 37 million Americans have chronic kidney disease right now, and most don't know it because kidney damage happens silently. By the time you feel symptoms like fatigue or swelling, you've already lost up to 90% of kidney function. But here's the twist. You might think you're hydrated while actually damaging your kidneys. Coffee, tea, and soda don't count as hydration. Caffeine and alcohol are diuretics that make you lose more water than you consume. So you're drinking liquids all day but still chronically dehydrated. Your morning routine is probably destroying your kidneys without you realizing it. You wake up, grab coffee immediately, maybe have some orange juice, then continue with caffeinated beverages throughout the day. Each of these choices creates a water deficit in your body. Here's what happens inside your kidneys during chronic dehydration. Your blood becomes thick like syrup instead of flowing smoothly. Your kidney filters, called glomeruli, have to work 3 times harder to push this sluggish blood through their tiny meshes. Over months and years, this constant strain causes microscopic tears and scarring. The scary part, your kidneys have 0 pain receptors. They can't scream for help when they're being damaged. Unlike a sprained ankle or a headache, kidney damage gives you no warning signals until it's often too late to reverse. Your urine color reveals everything about your kidney health, and most people are reading it completely wrong. Dark yellow means your kidneys are in crisis mode, desperately trying to conserve every drop of water. They're concentrating your urine to dangerous levels, creating the perfect environment for kidney stones to form. Pale yellow means they're functioning properly with adequate hydration. But here's what surprises most people. Completely clear urine means you overwhelming your system and flushing out essential electrolytes like sodium, potassium, and magnesium that your kidneys need to function. There's also a timing factor most people ignore. If your first morning urine is dark amber, your kidneys have been struggling all night long. This is when most kidney damage actually occurs, during those 8 hours when you're not drinking anything. If you're taking any medications, and most people over 50 take at least 3, you're facing double jeopardy for kidney damage. Blood pressure medications, diuretics, diabetes drugs, and even common over-the-counter pain relievers like ibuprofen all affect how your kidneys handle water. Here's the dangerous part. Many of these medications mask the early warning signs of dehydration. Blood pressure pills can prevent the normal rise in blood pressure that would signal dehydration. Diabetes medications can affect your thirst sensation. Pain relievers can reduce the kidney's ability to concentrate urine effectively. If you take any medication regularly, your hydration needs increase by at least 20 to 30%, but nobody tells you this when they hand you the prescription. Your kidneys can only process 1 liter of water per hour, so chugging huge amounts actually stresses them more. Instead, sip consistently throughout the day. This is called microhydration, and it's the most effective way to support kidney function. Start tomorrow with 16 ounces immediately upon waking, before coffee, before anything else. Your body has been without water for 8 hours, and your kidneys need hydration to start filtering effectively. This single change can improve kidney function by 15 to 20% within just 2 weeks. Throughout the day, follow the every 15 minutes rule. Take 2 to 3 sips of water every quarter hour. This keeps your blood volume steady and prevents your kidneys from going into conservation mode. Age makes this crisis worse in ways most people don't understand. After 40, your kidneys lose about 1% of their filtering capacity each year. Your thirst sensation also decreases by nearly 30% after age 65. This means older adults face triple the risk of dehydration damage. But here's what's even more concerning. Age-related muscle loss means you store less water in your body. Younger people store water in muscle tissue, but as muscle mass decreases with age, your water reserves shrink dramatically. This makes every hour without adequate hydration more dangerous. Women face additional challenges after menopause when hormonal changes affect kidney function and water retention. Men often ignore early warning signs, thinking kidney problems only happen to other people. When you exercise or work in hot weather, you lose water and electrolytes through sweat. Most people make the critical mistake of replacing only water without minerals. This actually stresses your kidneys further because they have to work overtime to maintain electrolyte balance. The rule is simple. For every hour of sweating, you need 16 to 20 ounces of water plus electrolytes. Natural options include adding a pinch of high-quality sea salt to your water or eating foods rich in potassium like bananas or avocados. Signs you're not replacing electrolytes properly: muscle cramps, dizziness when standing, headaches after exercise, or feeling more tired after drinking lots of plain water. Here's the good news. Unlike other organs, kidneys can recover when you fix your hydration habits. Proper hydration can reverse early damage and dramatically reduce kidney disease risk. Studies show that people who improve their hydration habits can recover up to 40% of lost kidney function within 6 months. Your daily hydration protocol: wake up, drink 16 ounces immediately. Keep water visible and sip every 15 minutes. Monitor urine color. Aim for pale yellow. During exercise or heat, add electrolytes, not just water. Quality matters more than you think. Use filtered water if you're concerned about contaminants like chlorine, fluoride, or heavy metals that can stress kidneys further. Avoid relying on caffeinated or sugary drinks for hydration. They actually make dehydration worse. Track frequency too. You should urinate every 2 to 3 hours during the day. If you're going for hours without urinating, or if urine stays dark despite drinking water, increase intake immediately and consider consulting a healthcare provider. Consider your individual factors. Larger body size means you need more water. Hot climate, medications, pregnancy, or breastfeeding all increase your needs beyond basic recommendations. A 200-pound person in Arizona taking blood pressure medication needs almost twice as much water as a 130-pound person in a cool climate taking no medications. Calculate your baseline. Have your body weight in ounces, then add 12 to 16 ounces for each hour of exercise, 8 ounces for each caffeinated drink, and an additional 20% if you take medications that affect kidney function. This isn't a one-time fix like brushing your teeth. Proper hydration must become automatic. Your kidneys are resilient but need consistent support every single day. The simple act of drinking water correctly could prevent decades of kidney damage. Start right now, drink a full glass of water, then commit to sipping consistently throughout today. Your kidneys filter your blood 24/7 for your entire life. Give them the hydration they need to keep you healthy. Small daily changes prevent massive future problems. Remember, your kidneys are counting on you. Make proper hydration your non-negotiable daily habit, and your future self will thank you for making this life-changing decision today.